Okay, well, welcome to our second episode of Interviewing Alums. I'm Charlie Foster with the Office of Student Veteran Engagement at William & Mary. I am joined by Captain Justin Rhodes from William & Mary's ROTC, or Military Science Department. And today we have interviews with Maureen Peterson and Karla Davis, two Army colonels who are alums from William & Mary. So they have been kind enough to join us today. And they are going to field a few questions from Captain Rhodes and from myself about their time at William & Mary and their time in the military. So thanks to both of you so much for joining us. And if you don't mind, I think we should just jump right into the questions. So Maureen, we'll start with you. Can you tell us a little bit about yourself, your class year, your major and minor at William & Mary, and maybe some extracurricular activities or memorable experiences you remember from the college?
Sure. So I'm from the class of '94. I graduated with a major in biology and minor in psychology. As far as extracurricular activities, I was very involved with Pershing rifles and was the commander for Pershing rifles my senior year. I was also in a sorority, and as Karla will tell you, she was one of my sorority sisters.
Nice.
So not only have our career paths kind of followed, but they started the same when we were at William & Mary. And I would say memorable experiences, there's tons of them. And the friendships, I would say, is the best memories that came from being a William & Mary ROTC grad. That I, to this day, keep in touch with tons of folks that did ROTC and Pershing rifles with me. And one of the great memories that I have is preparing to go off to advanced camp and working hard with my ROTC classmates to make sure that we were ready to go, and continuing to prep with doing ruck marches around Burke Lake after school got over in Northern Virginia with Matt Fine, who was one of the individuals who you just finished interviewing, preparing to go off to advanced camp. So the friendships that are made during the times there, I absolutely say will last a lifetime. I am a physician in the Army, and my career path, I went to William & Mary and knew I wanted to be a pediatrician from the time that I was little. When I went and found ROTC, I fell in love with the Army. And after advanced camp, decided that I wanted to fly Blackhawks. So I decided that I was going to branch aviation, and called my parents and said, look, Mom and Dad, that I do not want to be a doctor anymore. I want to go fly helicopters. And I can remember that conversation like it happened yesterday, with my mom in tears saying, oh my gosh, you're going to die. And me kind of compromising with them and saying, okay, fine, I will put educational delay for medical school first and aviation second, and I'll leave it up to the Army on what they're going to do with me, because I'll be happy either way. I had done all the prep for both, and it was kind of a funny decision, because I had performed well in school and performed well in ROTC, so I ended up getting an educational delay. and still to this day want to fly helicopters, and I will before I die, but it won't be with the Army.
Well, that's a great rundown of your choices, and of course that all started at the College of William and Mary. Okay, Karla, you heard Maureen's introduction, and she actually shouted you out a little bit there. But if you could, please tell us a little bit about yourself, your class year, major and minor, and one or two extracurricular activities or memorable experiences that you remember when you're at William and Mary.
Absolutely. And as Maureen said, I have to echo, it's amazing to see the intertwining of the relationships from William and Mary. And I'm so thankful to have been so blessed throughout my career to keep following Maureen's footsteps and learning from her and being mentored by her. So I indeed was a 1997 graduate. My major was government with a minor in biology. And I remember Maureen as a senior when I was a freshman and admiring her and looking up to her then, which I still do to this day. In terms of extracurricular activities, I was involved in ROTC and a sorority in college. Fond memories, gosh, the Pershing rifles, absolutely. I remember running around campus with Justin Herberman and Emily Frazier all through the middle of the night and into the following morning. It was an interesting experience, to say the least. Lots and lots of fond William and Mary memories, and I love to go back to Williamsburg. I was so lucky with my last station to be stationed at Fort Eustis, and one of my favorite things was to go to Williamsburg. After college, I did my medical school at EVMS in Norfolk, so got to stay in the area, which was wonderful because as the students now know, you've got friends that are the year above, friends that are the year below, friends that are 2 years below, so got to keep a lot of those close relationships through graduate school. And then moving on from there, I also am a physician in the Army and did my training at Madigan Army Medical Center and then Walter Reed Army Medical Center.
Well, that is great. So you guys kind of started into the next little section of questions, which is about your branch of service, your MOS, your duty stations, and you're both physicians. So I think we probably should get right into the most important topic that's going on in the world right now, which is COVID-19, the coronavirus. So please, doctors, tell us what to think, tell us what to feel and what to expect. Karla, do you mind going first? Can you talk a little bit about what it's like to be an Army doctor right now?
Sure. It's honestly super interesting times to be an Army physician. I am in Hawaii. I'm stationed at Tripler Army Medical Center, and we are behind the mainland, certainly behind the East Coast, certainly behind New York, certainly behind New Orleans. So it's kind of like watching a storm brew over the horizon. You see those clouds, you know it's going to get stormy, but we don't quite see the rain yet. In terms of what to think and what to feel, I think that we should be cautious and observant. I think that the sound guidance coming from Dr. Fauci is what I am taking to heart. If he says wash your hands and wear a face covering and stay inside, I think that is incredibly sound. I read a biography of Dr. Fauci the other day, and he and a group of his medical school classmates, Vietnam era, did not join the armed forces, rather were selected to the public health service. And if you look at that group of contemporaries who wore a different uniform than the Army uniform and wore the public health service uniform, they are pioneers in medicine. I think that we don't know a lot about the coronavirus, wish we knew more. I think that there is increasing concern for respiratory spread, not in the big droplets that we think about when somebody sneezes or coughs on your shoulder, but the tiny droplets that are transmitted when we just speak. So I think the guidance for social distancing, copious hand washing to make sure you don't accidentally infect from a surface, and acting like you have coronavirus and are a risk to your friends and family or other people in the grocery store is sound advice until we know more. Those are my thoughts.
Thank you so much for sharing that. Maureen, how about you?
Yeah, I would completely echo what Karla said, that this is an incredibly unusual time for all of us. And listening to what Dr. Fauci is saying is so important. It is absolutely infuriating to see people not take social distancing seriously, because it's not, and some folks think, well, I'm not going to get sick. Well, yeah, you may not get sick, but you can be asymptomatic and pass it off to somebody else who's going to get really sick. So social distancing is there to help with stopping the rest of the virus from spreading throughout our country. The ramifications all of us are experiencing with having small businesses looking at possibly never opening again, people losing their jobs. The economic impact is huge. But I would also say it shouts loudly how important military medicine is. And prior to the pandemic, military medicine was under a lot of heat, actually, for not providing such a huge service and potentially looking to downsize to save DoD dollars. I think now, with what is going on in the world, it shows how important the leadership lessons learned through the military are critical in a crisis, and that military medicine is getting looked at now as the folks who are going to step in and step up to really help our country. But taking things and advice like washing your hands, like using a face mask, like social distancing are incredibly important right now, incredibly important.
And Maureen, I know you're at Walter Reed. Can you just talk about what it's like to go into work? I mean, many of us want to thank healthcare workers right now for going towards the scary virus. So can you just talk a little bit about that?
Sure. I can tell you it's weird going into work right now. And the reason I say that, Walter Reed in Bethesda is a very busy facility. In my position, I'm the Chief of Graduate Medical Education. So I'm in charge of the interns, residents, and fellows who are in training at Walter Reed. We have about 70 different training programs at Walter Reed. And so there's a lot of people that work in that facility. Well, because of what's going on, there's a big push right now for folks to telework. So walking into the hospital right now, it is quite eerie, because that hustle and bustle that usually goes on in the hospital just isn't there right now, appropriately so, because people shouldn't be coming in unless they need to be there. Just from the moment you step into the hospital, you are met at the door with someone wearing a mask who is asking you questions about, do you have a fever? Do you have any cold symptoms? So that they can quickly route that person to the access point to get tested for COVID before going throughout the facility. So it is very different. Elective procedures are not going on. Elective appointments that can wait are not going on. So the number of patients that is usually seen at the facility is very different than it was before. We have testing tents that have now, for the past couple weeks, become a more kind of semi-permanent area outside of the hospital, so that people can go quickly get routed through testing. But it's very different. It's a very different feel to the hospital right now.
Karla, is that kind of what you're seeing out in Hawaii? Does that sound pretty similar?
That is exactly what we're seeing. We also have semi-permanent tents near our emergency room entrances. We have a entrance, rather than the multiple entrances normally that you can access our institution, people are moving through 2 entrances in order to be screened. And they have done a beautiful, beautiful job. Honestly, you're gonna laugh at marking on the ground with tape, 6 feet intervals. That way, it's a cue to remind yourself to keep that social distancing as you are asked questions as you enter the building, for everyone's safety.
Well, that's great. And again, thank you to you both for doing what you do, you know, and that's on behalf of myself, but also the student veterans and everybody at William & Mary. You know, we're just proud to have you guys as alums and be doing this great work. So thank you for that. How about just from your career, memorable experiences? So along the way, what are some of the places that you've been and things that you've done that are particularly memorable to you? Maureen, we'll let you go first.
So you asked in the question before too, I think, about our MOS and that sort of thing. And so answering the question about memorable experience, I'll kind of also answer the previous one about MOS. I am a 60 Mike, which is an allergist immunologist. So I graduated from William & Mary and went to the Uniformed Services University, which is the military's medical school in Bethesda, Maryland. And that was a little bit different than Karla's path, and Karla can expand and tell you a little bit more about how she got into medicine. But the Uniformed Services University is, like I said, the military's medical school. There's Army, Navy, Air Force, and Public Health Service students who all attend there. Everybody at the school is on active duty. So myself, when I entered USHIS, I was a second lieutenant throughout my 4 years of medical school. Upon graduation from school, you receive a degree in you'd receive an MD and you get commissioned as a captain. So I was never a first lieutenant. The difference compared to the route that Karla went through, for that time, I owed the Army 7 years of active duty service, in addition to the time that I owed them for paying for my tuition at William & Mary. So that was in addition to that. After I graduated USHIS, I went and did a pediatric internship and residency at Tripler in Hawaii. Tripler's awesome, and I'm jealous that Karla is there now because social distancing with sunshine is amazing, I am sure. And I did pediatrics, and after I was done with residency, I practiced general pediatrics for about 6 years. And then went and subspecialized and did a fellowship in allergy immunology. So now, as an allergist immunologist, I take care of children and adults. Even though I was trained as a pediatrician, and throughout my career, like I said, I've been on active duty since the time that I was commissioned a second lieutenant during my ROTC graduation. And memorable experiences are kind of too numerous to count. The one opportunity that kind of stands out in my mind, though, is receiving the Expert Field Medical Badge, or EFMB. EFMB is a badge that tests medical skills along with military soldier skills, along with physical fitness. When I went into the medical profession, I always thought, you know, I really want to go for and try to get the Expert Field Medical Badge. And I put it off and put it off and put it off. And then finally, when I was a lieutenant colonel, the opportunity came up to train and test for the badge. There was about 200 individuals who started the testing portion for the badge. And at the end, there were 20 of us that ended up getting the badge. It was an incredible experience because I got to really get to know a lot of medics and younger medical officers that I would have never met or interacted with otherwise because they were outside of my field. But for that testing and that training and testing time, we were a team. And I wasn't a lieutenant colonel, but I was a candidate for the badge. And I was looked at as a member of their team just like anybody else. And it was such a great lesson in leadership and a lesson in camaraderie. And that's probably one of the experiences that I hold very close to my heart.
Yeah, it sounds incredible. Karla, how about you? Just some of the places you've been. I think a little bit about how your path has wound through your service, and yeah, any memorable experiences for you too.
Sure, thank you. So I graduated from William & Mary in 1997, and I had a different path. I had applied to a program through William & Mary with EVMS, where I applied as a sophomore to EVMS. And essentially the acceptance to medical school was contingent on continued success in undergraduate. So I had the acceptance to EVMS relatively early in my undergraduate career at William & Mary. And then I had an educational delay for my ROTC obligation as I left William & Mary. The first year of medical school, I didn't have a scholarship, but for the last 3 years of medical school, I had what's called an HPSP, Health Professions Scholarship Program scholarship. So at the end of my medical school, I was also a second lieutenant, and I owed the obligation from my ROTC and then 3 years for the medical school scholarship. So coming out, I also was commissioned as a captain and never spent time as a first lieutenant, but had 7 years total obligation to the Army. I did my residency in pediatrics at Madigan Army Medical Center, and then I went right from my residency in pediatrics to allergy immunology fellowship, which was unusual at the time. At the time, it was really, really common for folks to spend time in their primary field and then go into fellowship. And that's just how the stars aligned for me, and I was thrilled to do it that way. Sometimes I have a moment of regret when somebody tells stories about their time as a general pediatrician, because I didn't do that. But I wouldn't change a thing. I would absolutely go right to fellowship again, given the opportunity. After completing fellowship at Walter Reed, this is now 2004 to 2006, I went to Landstuhl, and I was in Landstuhl from 2006 to 2010, with exception of a trip to Iraq from Landstuhl. And a big memory for me at that time was my mom and dad would come over. My dad is a retired reservist, and they would come over to Landstuhl Space Day sometimes. And I remember to this day that they were flying out of Andrews on a space day flight to come visit us in Germany, and had been staying at Bethesda. And they stayed at the Navy Lodge on Bethesda and got to talking to another family there. And the family there at Bethesda was visiting a wounded warrior who was inpatient at Bethesda. And they said, "Thank you so much to my mom and dad for what your daughter is doing at Launchstoel to take care of our son." And my parents were floored and tearful in the receipt of the thanks, because they said, "Gosh, she's honored to be there and honored to be a part of Launchstoel." And what a kind thing this family to express when they had a whole lot of scary things on their plate for their family. So it was an interesting time at Launchstoel, to be quite honest with you. They would call regularly for support to come down, because what we call a CCAT, critical care air transport missions, would come down, and they would need extra hands to take care of patients and move them from the flight line at Launchstoel to the ER at Launchstoel. It was a really, really busy time. And that stands out to me as a positive memory, where we really felt like, as an institution at Launchstoel, that we were making an impact, a good impact for people. After Launchstoel, I did ILE, which was at Fort Leavenworth, and then was stationed in Hawaii, then moved on to Fort Hood for 2 years. And then my last 2 years before I came back to Hawaii was at Fort Eustis, so right down the street from you all. Was really fun to be back. And then I moved back to Hawaii in 2018. Another huge memory for me that stands out would be, as a resident, I got to spend time in Kenya, a month. There are research teams, military research teams throughout the world doing research in various places. There's a Navy team in Peru. One of Maureen and my colleagues, Chris Soltis, is a colonel here at Tripler as well, and he was stationed in Thailand doing research. And I, as a resident, so learning how to be a pediatrician, spent a month in Kenya with a team doing malaria research, which was absolutely amazing to see that in progress. Like Maureen, I'm an allergist, a 60 Mike, and we both have 60 Papa as another designation as pediatricians.
Well, that's great. Thank you so much for giving us the rundown. So the next question for Maureen, we'll have you go first. And this one is kind of along the ROTC line. So this, I predict, is one of Justin's questions. So Justin, feel free to chime in and modify the question if you need to. Do you guys have any advice for junior officers just starting out? We asked Matt and we asked Charles, and they really let fly with some stuff as they look back on their careers. They thought of advice that would help out those junior officers. So how about you, Maureen?
My big advice is kind of twofold. One is always take advantage of opportunities, and sometimes those opportunities look like work, because they usually are work. But the opportunities that come to you when you're a military officer is very different sometimes than the opportunities that come to folks if they're not in uniform. And so making sure you take advantage of those things, I think, is pretty important. And I'll give you an example of what I'm talking about. When very early in my career, I knew I loved teaching. So I would do a lot of lectures. I would mentor interns and residents in pediatrics. I got presented with the opportunity to be the associate program director for the pediatric residency program. That was a combined residency program between Walter Reed Army Medical Center and National Naval Medical Center in Bethesda. I knew that opportunity was going to be work. But in the civilian world, that opportunity, there's a lot of thought and that has to go into that. For me, there was some thought, but I didn't have to worry that my pay was going to change for taking on that role or duty. In the civilian world, it may have changed because having seen the way civilian physicians make money is by the number of patients that they see. Well, when you have a administrative duty to help out with training people, the number of patients you're able to see in a week is less than somebody who doesn't hold on that duty or role. But if I had said no to that, my career would not have gone the way that it has now. And I know that when I finally take off the uniform, I am very much set up for a job in civilian medicine. The second piece of advice, though, that I would say is make sure you don't always say yes. And what I mean by that is when somebody presents you with an opportunity, I think it's important to take kind of a time out and look at the things you have on your plate to make sure that you have room to be able to do that job and do it well. Because what you don't want to do is say yes to everything and have a plate that is overflowing where you're just not doing anything well because nothing has your full kind of undivided attention. So I always teach younger officers that it's okay to say no sometimes, that you want to take appropriate advantage of opportunities, but you want to do it in a way that you are really evaluating what you have on your plate.
Well, that's great. That is great. Two pieces of great advice there. Karla, same question to you. What advice do you have for junior officers who are just starting out?
I think two pieces of advice as well. Number one, work hard and be enthusiastic at whatever you approach. I would so much rather take on a colleague who is inexperienced and hardworking than the opposite way around, experienced and not hardworking. So I think to model that, if you don't know something, you can learn it and you can apply yourself to it and you can work hard and be good at it. The second piece of advice I would say would be to stand up for yourself gracefully and politely. I'll give you two examples from my career where I am glad that I did. Number one was in Germany. A new doctor was coming into the office and he is senior to me by rank, but I had held the position of clinic chief. And my Department of Medicine chief said, I'm going to give the position of clinic chief to the incoming officer rather than you because he's senior to you. And I stood my ground and I said, I've been doing the job well. We can collaborate and find a title for the incoming officer that gives him a scope of responsibility and a title, but I don't think it's appropriate that you're taking that title from me simply based on somebody else's seniority. And that worked out well. My inbound partner from Germany, we divided and conquered. We were great partners and great friends. The Department of Medicine chief was pleased with the ultimate division of responsibility, but if I had not stood my ground, I would not have stood my ground in that circumstance. Gracefully and politely and finding a win-win solution when you attempt to stand your ground, I think would be the takeaways that I took from that.
Well, that's great. One of the things that I think our young folks, our junior officers wonder about, what would like to pick your brains about, would be leadership. So Can you just talk a little bit about leadership, your views, advice on leadership that you would give to some of our young leaders to be? Maureen, if you wouldn't mind going first.
I have a ton of advice about leadership, but so one of the opportunities that I have had throughout my career is doing teaching. And one of the topics that I love teaching about is leadership. So I do say in somewhat jest that I have a lot of advice about leadership, but I really do have a lot of advice about leadership. But keeping to the things that I think are most important is, as a leader, I think it's very important to understand yourself and know what sort of things make you have bias, because all of us have a history and experiences that cause us to have bias. And so understanding that so that you're making a decision that is an unbiased decision as a leader, I think is very important. For example, one of the things that in my life that I have had is that I throughout my career have loved being a mom. I have 3 children. It's the best job that I have. My middle child, when she was 6 months old, was diagnosed with neuroblastoma, which is a type of cancer, went through surgery and chemotherapy, the whole works. And when I came back to work to see pediatric patients after that, I would come into clinic and parents would bring their children in who had a rash. And I would feel myself getting angry about, why are you bringing your kid in just for this rash? Like, do you understand what I just went through with my child? Like this, I can tell you, this is nothing. And I never said that, but it was pausing and realizing that the experience that I went through with my daughter, in that moment with a patient, I was being a medical leader. And that leadership decision on discussing their diagnosis I was bringing my bias about what had happened with my daughter to that discussion. And it was realizing that fact so that I could put that aside and realize that the parent was bringing their kid in because they were worried about their child, just like I was worried about my daughter. And so I then was able to feel humbled that they were coming to me to get an answer, and one that I could be able to soothe their worry and be a good leader that could be comforting in that moment. So understanding yourself, I think, is very important. Understanding others, I think, is equally important. If you don't understand the people who you are in charge of, you're going to fail as a leader, because you need to be able to use those people on your team to use their strengths and figure out what their weaknesses are. So, because that's going to be your team's weakness. So you really want to make sure that you understand it so somebody else can fill in that weakness. So understanding self and understanding others, I think, is pretty important. The biggest thing though that I would say as a leader is understanding your life in terms of rubber balls and glass balls. And you need to figure out who or what are your glass balls, because we are constantly juggling things in life. And you need to make sure as a leader that those glass balls don't ever get dropped when you're juggling. The rubber balls, they're okay to get dropped every now and again because rubber balls will bounce right back up to you. But glass balls, if you drop them and they shatter, that you're done. And so figuring out as a leader what you personally hold as your glass balls is invaluable.
Well, that's great. And I think all of those are applicable to everyone, not just our junior officers or our young folks, but me and everybody listening. So thank you for that. Karla, how about you? How about some thoughts on leadership for our young officers to be, and then for me too, and for everybody else?
It's hard to echo. It's hard to follow Maureen on this one, I must say. I think she did a beautiful job. I would say looking for the good in situations can sometimes be a valuable leadership lesson. When things look poorly, you as the leader looking for the good, and I don't mean an unrealistic portrayal of a situation that's not good, but looking for a shining light of good in dark times may be really helpful. Empowering others and underwriting risk. People make mistakes. People make honest mistakes. As a leader, you looking at your team and saying, I will underwrite any honest mistake you make, empowers that team to take some calculated risks. If you don't empower the team to take any calculated risks, you will be stagnant. And I don't mean that you should let your team do wild things that are unsafe, but letting them have a little bit of room to maneuver really does make a difference in what your team can accomplish.
Well, that's great. Thank you for that. And I think we'll start with you for the next question, which is a little bit of a combo question. So for our student veterans, many of them are close to graduating, and they're going into their job search, and they're starting a new career after the military and after higher education. So what do you think the value of a military background is in the civilian world, and especially in government service? And kind of along with that, how do you translate your military experience so that civilians can understand, whether that's in the civilian sector, the private sector, or in the government sector?
I am still in uniform and will be for a while, so I am not super well equipped to handle this question. I will tell you that for my field, I think that it's highly translatable. And I will tell you anecdotally that at an allergy conference years ago, I was in uniform because I was presenting a poster, and someone approached me not because they were interested in the poster, but because they were interested in the uniform. He handed me a business card and he said, when it's time for you to be done with your military service, call me. We like to hire ex-military. We like to hire ex-military because you're hardworking, you're talented, and you're good team players. So I would submit that that may be something that's highly translatable for all of the student veterans.
Definitely. That's great. Thank you. And I think they think that, and I think what they struggle with is translating the military experience. So it's really great to hear that somebody over on the civilian side already knew that, and that's always what we want to hear from our prospective employers. So that's great news. Maureen, how about you? How about advice or what you think the value of the military background is in the civilian world, and about translating military experience for the civilians?
Yeah, so I, like Karla, do still wear a uniform, but I would say, you know, from Karla and I's position in military medicine, in the civilian world, folks in uniform think, oh, that's easy to translate in the civilian world because everybody knows that the military physicians are doing the same thing as they would in the civilian world. Well, I would tell you, some people in civilian medicine do not understand that military medicine is medicine. I practice and see patients just like a civilian provider would. I would say from a medicine standpoint, something that should be highlighted when I look for a medical job is the type of medicine that we practice in the military, meaning that whatever I see, my paycheck is not going to change. I get paid based on my rank and time in service. I'm not paid for the number of patients I see or the number of procedures that I do. In the civilian world, that's not the case, that civilians practice medicine and get paid based on patients that they see, procedures that they do, because all of that can be reimbursed by insurance. So when I practice medicine, I don't have to worry, is a patient going to go pick up their prescription? Because I know they will, because it's not going to cost them like it would in the civilian world. I also know that the medicine that we practice in the military is evidence-based medicine, not economics-based medicine, which should be highlighted to the civilian world. And I think a lot of civilians know that, but there are a lot that don't know that. And so that should be highlighted along with, and Karla has held, she's being very humble, but she has held phenomenal leadership positions in military medicine. And that leadership, those leadership positions, typically in the civilian world, are held by folks in very senior roles. And so being somebody who was junior, holding that position and doing it well, I think is another thing that should be highlighted when, and their ability to be a good leader and to be resourceful are traits that military officers, I think, often have.
Karla, I'm going to ask you to respond to that pile of praise just there. And can you talk a little bit about how you kind of positioned yourself to be in those roles? I mean, one of the things that I think is common between ROTC cadets and student veterans is that they're studying now. And did you research and write to get in these positions, and how were you able to be successful in preparation, maybe?
Sure. So one of the positions that I held that was a big educational opportunity for me was the job at Fort Eustis that I had before coming back to Hawaii. It is called the Deputy Commander for Clinical Services, DCCS. And in the civilian world, you might think about it as a chief medical officer for a hospital or a clinic. And that, to be honest with you, I did a good bit of homework talking to people who had held the position, asking them for lessons learned, asking them for mistakes that they made or things that they would do over or things that they did with good success. It is an incredibly eye-opening position to be on a leadership team of a hospital, because you see where the hospital works not only with regard to the patients that it cares for, but in the Army within the greater system and the greater ecosystem. Who would have known that you could go to the civilian hospitals in Newport News and asked for a tour and asked for cooperation for some of the facilities that they had. Who would have known the interaction that Fort Eustis has with Langley and with Portsmouth Naval on certain hospitalizations and the close interactions that have to take place in order for a patient to have an inpatient psychiatric bed at Naval Medical Center Portsmouth. So it was incredibly fascinating. And I learned from those, number one, who did the job before me. And number two, I learned a tremendous amount from my boss, who was a great, great leader and gave me some opportunity to make mistakes in a constructive way.
Well, I definitely think that's the kind of advice that, that the students can follow, for sure. Well, I've taken up a lot of the time asking my questions. Justin, how about you? Do you have any follow-on questions or anything specific to the ROTC cadets?
I have one big one. I think it's important for new-to-be commissioned lieutenants. And Colonel Peterson, nice to see you again.
Good to see you.
Of your brief last year with Matt Fine, it was really awesome. It's too bad we didn't think to have you screen share some of those photos from the EIB. I think maybe later we can add some of those. My main question is, medical readiness is huge in the military. What is your advice, Colonel Peterson and Colonel Davis, for how a brand new platoon leader should handle their platoon's medical readiness?
Karla, do you want to answer? You want me to answer?
If I may, I'll take this one just because it is germane to my experience yesterday. So yesterday I got a call around noontime from a group in Hawaii that is going to another Pacific island. They left this morning at 5 a.m. And they said, hey, can you help us with immunizations because we're leaving in less than 24 hours. And I said, of course I can help you with immunization. We wound up opening the clinic and sending in a member of our team to immunize these patients who were leaving at 5 a.m. this morning. And we spun that up over the course of about 2 hours. The subsequent conversation on our end is, hey, how can we be better as a supporting element for that warfighter team that's going to have a rapid fire deployment? And I think that we did a good job in that we opened the clinic within 2 hours, sent somebody in on a Sunday afternoon and immunized. But I think part of the challenge was that that group didn't have their immunizations in order to start with. So it left them in a behind role and it left us in a behind role. We know that you're not going to get the maximum benefit from your immunizations until about 4 to 6 weeks after you get them. So if you are in a leadership role of a unit, and you've got to know your unit, because I, as the medical person, I don't know what your unit specific tasks are. Are you a rapid fire deployer? Do you go out the door in 72 hours? Do you do specific missions in specific places, or could you go anywhere at a moment's notice? Knowing what you are in your role as a platoon leader will help you communicate with me on the medical side so I can do a better job for you. And I would say that would be the piece of advice I would give to somebody who's going to move into a platoon leader role. Know what you are and know how quickly you can do other things, because that helps me help you.
No, thanks, Colonel Davis, and that makes a lot of sense. My first command as a captain was a rapid report opening element. You deploy within 12 hours, and we had to be, immunizated. We had to be vaccinated for worldwide, and it was a big ongoing. On Fort Eustis, I'm not sure if we ever met when you were there, but yeah, you have to know where your unit's going or where it could go, and then plan ahead so you can work with the deployment readiness centers to make sure you're ahead of the game. Ma'am, Colonel Peterson, do you have anything else to add to medical readiness, how to be successful as a platoon leader?
Yeah, I think to summarize what Karla just said, it's just being organized and not being afraid to ask for help. That a platoon leader who is in a bind just needs to pick up the phone and call somebody to ask for help. And that's okay. The time you get into trouble is when you assume things and you're not asking for help. if you're asking for help, especially when it comes to things like what vaccines does your unit need for if they're going to country X, Y, or Z, you're going to get people like myself or Karla on the other end of the phone, and we certainly are not going to bite your head off. That we will sit there and walk you through what your unit's going to need and brainstorm with you on how to get your unit to where you need it. But it's being organized and making sure that that you know what your unit currently has. And it's disorganization that's going to get you into trouble.
So yeah, I completely agree, ma'am. You got to be organized. You have to know what's coming up due, whether it's dental, whether it's PHAs, whatever it may be. You have to be organized. You know who's coming up so you can forecast properly and coordinate. So that way, like Colonel Davis said, the unit, they're in a bind because they did not keep it updated, and now the soldiers are at risk. So future or soon to be lieutenants, to make sure you're organized and you're on your game. No, I like it. Now, I don't really have any other questions, Charlie. Talked earlier about advice for new lieutenants, advice on leadership. Those are my two big ones. I think I got something today that we don't usually get out of, which is don't be afraid to volunteer to do different things. And definitely as a new butter bar, you're gonna have a lot of opportunity to volunteer, you know, at the platoon level or company level. So no, I appreciate Colonel Peterson's time, Colonel Davis's time. I think our student vets and our William & Mary cadets are gonna get a lot from this.
Right, I just thank you also from me and from everybody else in the Student Veterans Group and at William & Mary. Thank you guys for taking the time and for these great answers and for doing what you do. It's an important time to thank healthcare workers. So thanks to y'all so much and for spending time with us and answering questions for your alma mater. Thanks for going to William & Mary to begin with.
Absolutely.
All right.
Do it again in a heartbeat.
That's right.
I'm glad to hear it. And
Hey, one note for, since Colonel Peterson brought it up, when I talk to cadets about what they like about the program, or we'll get high school students who come visit for a day, and I ask around the room, like, tell the cadets something about our program. And the number one thing is always said is the people, the relationships. That's the number reason why they're still in ROTC, and that's why they joined this program, is because of relationships. So that legacy is still continuing currently.
Oh, absolutely. Absolutely.
That's right. That's the tribe. So thanks y'all so much for being with us today. And we look forward to seeing you soon until everybody can come back to Williamsburg. We hope to have you there.
Great. Thanks for having us.
Thank you.
Absolutely.
Thank you for having us.
Thanks.